I'm going to knock into the room, provide for privacy, greet my patient and identify them, and perform hand hygiene. I'm going to establish a safe environment. I'm going to go ahead and assess the child, make sure they're not in any distress, no shortness of breath, anxiety, or pain. And I'm also going to make sure they look well groomed and have good hygiene. I'm going to establish a parent-child nurse relationship, and I'm also going to assess the parent and child's relationship with each other. Throughout my assessment, I will use language and teaching that is appropriate to the child's age, and I'm going to ask them if they are, make sure they're oriented to person, place, and time, and I would go ahead and get a full set of vitals before I begin my assessment. I'm also going to try to reduce anxiety as I go through my assessment. So I'm going to start with the head. I'm going to measure the head circumference and look at their head and face and neck, make sure everything's symmetrical. I'm going to look at their hair growth, and I'm going to look at their ears, make sure their ears are symmetrical, and their eyes. I'm going to look in their ears. I'm going to check for any wax, edema, or any foreign bodies, and I would also perform a whisper test. And I'm going to look at their eyes. I'm going to make sure their pupils are equal, round, reactive to light. I'm going to ask if they wear any glasses or contacts, and I'm going to I would have them read a medication bottle if that was age appropriate, and I would also check their pupillary accommodation. And I'm going to look at their nose, make sure they don't have any drainage. I'm going to look in their mouth and look at their oral mucosa, make sure everything is normal. I'm also going to assess their swallowing, and I would have them say something if that was age appropriate, and have them talk to assess if their speech was clear or not slurred or anything. I'm also going to ask them if age appropriate. I would also ask if they're suicidal or homicidal. I could also speak to the parent about that if needed. And then I would do my neuro assessment. So I'm going to have them extend their arms and rotate them to the supination position. I would have them flex their arm and make sure they can provide resistance both ways. And I would do all of that in both hands, or both extremities. And then I would do abduction and adduction in each leg. I'm going to have them bend and provide resistance against my hand on their thigh, and do dorsiflexion and plantar flexion of their feet. Make sure they provide resistance with that. And I think that's it. Okay. So I'm going to do I would have them lift their legs and make sure they can hold them up off the bed as well. Okay, and then I'm going to do my cardio assessment. So I would listen to their heart sounds, and I'm listening to the pulmonic, tricuspid, mitral, and aortic heart sounds, making sure that those are all normal and equal. And I'm also looking at their chest circumference, making sure that they don't have any abnormalities. I would look at their chest, make sure there's no rashes, bruises, or lesions. I would also go ahead and assess the skin turgor on their chest. And I'm going to check all their pulses. So I'm going to check both of the carotid pulses, both radial pulses, and both pedal pulses. And while I'm checking their pulses, I would also look at their extremities. I'm going to check their capillary fills in all extremities, look at the color, and feel the temperature of their skin, make sure they're not cool or discolored. And I'm also going to go ahead and assess the bottom of their feet and their heels for any abnormalities. And then I'm going to do my respiratory assessment. So I'm going to listen to their breath sounds in the 10 anterior locations. and the 4 lateral locations. And then I would also sit them up, and I would listen to the 10 posterior locations and also look at their back and inspect it for any abnormalities, rashes, lesions, or bruises. And then I would move down to their abdomen, and first would inspect it, make sure that there's no bruising, rashes, or lesions on their stomach, and that also with the respiratory, I would assess their respirations and make sure they assess the quality of their respirations and that their chest rises and falls equally. And I would also assess for any coughing, if it was productive or non-productive if they have one, and any sputum. And then I would move on to my abdomen, so I would do inspect it and look for any abnormalities, and then I would listen and to the bowel sounds in all 4 quadrants. And then I would do light palpation, and I'm checking for if they're soft, firm, or distended. I would ask when their last bowel movement was, if they had any diarrhea or constipation, any nausea or vomiting, any abdominal discomfort, and if they were eating okay. And then I would go to their genitourinary, so I'm going to assess their urine. I'm going to look at the color, the frequency, ask if they're having any urgency going, if they are continent, if they have any pain, or color, frequency, and the amount that they're peeing when they do go. And then I would look at their genitalia, and I'm looking for any odor, discharge, any bruising, rashes, or lesions. And if it was male, I would also look at the foreskin and make sure everything's normal. And then I would do my musculoskeletal assessment. So I'm going to have them grasp my hands and make sure that they have equal and strong hand grip. Then I'm going to look at their muscles and make sure they aren't having any spasms, and if they're toned or flaccid. And then I would have them do all ranges of motion, and then I would have the child get up and walk. If age appropriate, I'd have them get up and walk and assess their gait, make sure that it's equal and normal. And I would have them come over and bend over and touch their toes, and I would assess for scoliosis or kyphosis. And I am going to assess for any edema in their extremities, and look at their skin all over, make sure they don't have any abnormalities, bruising, rashes, or lesions, or anything like that. And I would only assess their perineal area if they had any history of breakdown or as indicated. And I would also, if I needed to restrain, I would restrain appropriately throughout my assessment as needed, if age appropriate. And then I would just document and report.